What is chronic urinary retention and overflow incontinence? Imagine feeling like your bladder is a stubborn reservoir that just won't empty completely no matter how often you go. That's what happens in chronic urinary retention. It's a condition where the bladder doesn't fully empty over a long period, leading to a buildup of urine inside. People with this condition might notice they have trouble starting to urinate, or their urine stream may be weak or stop and start. They might also find themselves needing to urinate very often but only passing small amounts each time. Sometimes they feel a sudden urge to go right after they've finished, or they might experience mild lower belly discomfort. In some cases, urine may leak out unexpectedly, especially during sleep, which can be embarrassing and confusing. Overflow incontinence is closely linked to chronic urinary retention. Because the bladder stays overly full and can't empty properly, urine begins to leak out on its own. This leakage can happen suddenly or as a continuous dribble. It occurs because, as the bladder fills beyond capacity, pressure builds up and urine escapes around any blockage or weak muscles. Many people with overflow incontinence don't even realize their bladder is full until they see urine leakage. This can cause discomfort and increase the risk of infections because residual urine left in the bladder can promote bacterial growth. The causes of these conditions are varied. One common reason is an obstruction in the urinary pathway, such as an enlarged prostate in men, bladder stones, or narrowing of the urethra. Weak bladder muscles, known as detrusor muscles, that don't contract properly can also prevent complete emptying. Nerve damage from conditions like spinal cord injuries, diabetes, or neurological diseases can interfere with bladder sensation and muscle control. Certain medications may also slow down bladder emptying. In women, causes are less common but can include nerve damage, diabetes, medications like diuretics, or weakening of the bladder muscles. If these issues are left untreated, they can lead to serious health problems. The bladder can become damaged from overdistension, and recurrent infections are common because bacteria can thrive in residual urine. Over time, the increased pressure can even affect the kidneys, leading to chronic kidney problems. That's why proper diagnosis is essential. Healthcare providers typically evaluate symptoms, perform physical exams, and use tests like ultrasound or measure residual urine after urination to confirm incomplete emptying. Treatment aims to address the root cause. For example, if an enlarged prostate is blocking urine flow, medical or surgical options may be necessary. Improving bladder muscle function or managing nerve issues can also help. Sometimes, catheterization is used temporarily or long-term to ensure the bladder empties properly and prevent damage. It's important to distinguish these conditions from other bladder problems like overactive bladder, as treatments differ. Accurate diagnosis helps prevent worsening symptoms and complications. From a bladder health perspective, recognizing that chronic urinary retention and overflow incontinence often signal underlying issues like outlet obstruction or nerve problems is key. Persistent retention and infections can harm bladder tissue and overall urinary health. If you notice symptoms like difficulty urinating, leakage, or frequent infections, it's important to see a healthcare professional for proper evaluation. Managing these conditions early can help maintain bladder function and prevent more serious health concerns. Remember, each person's situation is unique, so personalized medical advice is always the best course of action.